Time being 6:01, I'd like to call the Board of Health meeting to order. All members are present. The first item on our agenda is COVID-19 update, so I'll throw that over to Marty.
All right, good morning. As you heard from the news, I'm sure everybody's paying attention to, um, we're fastly approaching or have surpassed some pretty grim milestones. 10 million cases in the States, almost a quarter of a million deaths in the nation, over 10 million, 10,000 deaths in the state. We are currently, Abington is currently at 41 active cases with around 66 contacts being traced. I expect that number to increase because we had a very complicated case today. And that's where the town is at. The state was at, I haven't checked the numbers for today, but I believe it is about 184. And that's not good. And with the current spike, and then with the holiday this past weekend, town meeting, Thanksgiving, and the December holidays and New Year's, I really hope people are going to be making smart decisions to not spread this as much as we can, at least. So currently, I'm going to segue slightly. It has to do with COVID, and our town meeting is on tomorrow night at 7 at the high school. If you're attending, please wear a mask, and do not come if you are sick. I'm sure we can make some type of arrangements for you, but please, I'm begging you, do not come if you are sick. That is the one thing we know that will spread it. So if you're feeling bad, anything like that, just don't come. Also, don't go to work if you're sick. That's one of the big problems we're having with spreading in the community. People continuing to go to work or school or anywhere else when they're not feeling good. And if you are a contact of a close case, if you're a contact of a known positive, please also stay home, follow the quarantine procedures, help protect your neighbors. Don't really have anything else for COVID updates. I know I sound like a broken record every other week, and I apologize, but we got to stay the course. COVID fatigue is real. I know it's hard, and we'll get through it, and we'll get through it a lot faster if we're all working together.
Right on. Any questions for Marty before we move on? Yes, everybody's good. Okay. Next item on our agenda, and just for our viewing audience, a reminder: this is just a discussion, COVID-19 vaccine discussion. So this is sort of a what if, when if. So I'll throw that to Marty as well.
So there has been a lot of good news coming out of the vaccine world lately. I'm sure everybody heard of Moderna, our local company based out of Cambridge, 94% effective. That is right up there on par with some of the vaccines that we know, love, and rely on and have for many, many years. And it also has a bit more of a shelf life stability that we were looking for, opposed to the other one where it has to be kept extraordinarily cold until it's just about to be given. I asked Brian Campbell. Brian, are you here?
I am.
Hi, Brian. Brian is I'm going to try to get your title right, so bear with me. Brian is Region 5C Public Health Emergency Preparedness Senior Planner. I believe I nailed that.
Very good.
He is the senior planner for public health emergencies for the 25, 26 communities that we have in Region 5C. I asked him to join us because we have been working extensively, me, Brian, and Sean, and Lindsay, and the school department's help on our plan to mass deliver the COVID-19 vaccine if and when we have to do it. Our plan currently, we already have a plan in place for people coming to the school facilities to get the inoculation and then to go through and leave. What we've been working on recently is a drive-through facility and the capabilities to do that, and the state approval and all of the associated headaches and benefits of doing it drive-through. Brian and Sean have been great in making sure that we are as prepared to do that as we possibly can be. And I think we started work on this Brian, correct me if I'm wrong, May, June. It was a long time ago we started. We started this process quite a bit of ways ago.
That is correct. And things have changed, periodically we get updates that we have to go back and we have to change something because it's something that the state, in case you didn't realize it, the state has a tendency to change things on a daily basis. So that is one of the things that we battle with, but it's also one of the things that's most important because we get updated frequently on it. What do you want me to tell them about, Marty? Because I can.
Mostly I just asked in case they had any specific questions about our plan that if you might be better answered, I might have to lean into you a little bit. But I think it's more that we're not looking at our plan in a bubble. We are looking as a region, and we are trying to do the best service to the town we can by making sure that we are not living in a bubble and also being aware of our bubble. And that's really it. Brian, if they have any specific questions, that's all I ask.
Yeah, sure. I have no problem answering questions. One of the things that I will point out to you guys ahead of time is the fact that by all information that we are getting, I know what the news is saying on TV that, they're going to produce millions and millions of doses of the vaccine. But everything that we've been told from the state level is that this is going to roll out incrementally. So it's not going to put everybody in a panic and have Marty at the high school for 24/7 for it's just not going to happen that way. But what's going to happen is the state's going to get X amount of doses, and however they distribute it, I have no idea, but they're going to determine how they're going to distribute it. And the first people that are going to receive the possibility of being inoculated would be the first responders and the healthcare workers. From my understanding, now this could change tomorrow, but that's how they're planning it right now. And that's coming from our Region 5C state coordinator is on the planning committee for the distribution of this vaccine. So she kind of has a little bit of an inside scoop, gives us the information, and that's part of the information is that she still feels as though it's going to roll out incrementally. So it should put a lot of people's mind at ease, even though there'll be a big push by the community to have everybody done. They'll be saying, well, why are these people getting it and not us? But you have to roll it out in that manner because of the fact that healthcare workers and first responders are the ones that are going to be going to the houses of people that have the issue with COVID. So
in the local aspect, we've been working and planning on all of those contingencies, having to deliver the vaccine to both fire and to police, and then to our elderly community. Obviously, we already have the Council on Aging facility, and that's where we would set up. If it was if we had a low number of doses that was specifically set aside for 65 and older communities, and then we'll phase it out to there. I mean, I'm sure a lot of people are going to want to go talk it over with their doctor anyway, so they'll go to their primary care physician for their own shots, and it'll be a lot like the flu shot in that we have the capacity to do it. And we can, at least that's my hope, and that is my intuition. Is that is what will happen.
Right.
Any questions?
So just a couple of questions on logistics, because I think this is what people would be curious about. So let's say the vaccine is available to the masses. Should people be going through the health department in their own town versus their doctors?
My recommendation would be always to check with your physician first. You may have some some reasons to not have to get it. We call those contraindications. You might have a reason to not get it. You might have, whether it be immunosuppressed and then you might, and some people, you probably need to talk to your doctor to make sure that it's the right decision for you and your family. If there is a specific reason for you to not get it, just like with the flu shot, our first go, if you call me and you say, hey, if you're concerned at all, then you should be seeing your family care physician or your kid's pediatrician first. And then after you're comfortable with it, then we can help you out. I would say if you're concerned, doctor first. And if they can't give it to you and you want to come to us, we will give it to you after that.
Okay. And if we were in a situation where there was a mass amount available to the community. I know we've talked about this amongst ourselves. Is there a logistically, what would it look like to get the town of Abington vaccinated?
Well, it will depend on the actual scenario we're in. It will. We think it's going to roll out incrementally. So that will be first responders, elderly, whatever the case may be. 100 doses for whatever, 100 doses for that. And at the same time, ideally, people are still going to their family practice or the pediatricians to get the shot at the exact, while that's happening. So it will probably, hopefully, now this is all blue sky day aspirational thinking, right? They'll also be able to get it at the doctor's offices, at the minute clinic, at acute care clinic, while also being able to get it from the health department in the town. Again, blue sky day, everything's great. There's plenty to go around, and we will offer. We've talked about, me and Lindsay have spent just inordinate amount of time discussing, we want to be able to say that we have talked about it before we have to talk about it. So what are we going to do? Clinic after clinic after clinic. The fire chief have help giving the vaccines. We've talked to nursing schools around the local areas. We'll talk to paramedic schools around the local areas. So when the rubber hits the road, we'll have a better idea as actually gets time to get the shots, as we get closer. Everything right now is aspirational speculation. But my intuition tells it's going to be incremental rollout, and we'll be able to, put out a message saying we have 100 shots right now. Please call to schedule an appointment, because COVID safety practices will still be in effect even when we have the vaccine in house. And we'll, just like the flu shot, we'll take a copy of your insurance card. We'll submit it and luckily we've done this for the flu. We have our own NPI numbers. We have our own Massachusetts immunizations. We have all of the infrastructure to make sure that we're doing all of that correct. So we got a good preview just doing the flu shots, and then extrapolate that further. We'll need more people given the shot. You'll need to hang out a little longer, because I imagine there will be a 15-minute cooling off period after you get the shot. So really, we won't know until we know, and at that point, we'll be able to sit around a table a little bit smarter, and okay, we'll get the Z by going through the rest of the alphabet. But hopefully, we'll know middle of December when they start giving it to healthcare providers and those in the higher risk brackets.
Marty, let's emphasize one thing though, because we've had enough meetings and talked about this enough that's ideally on, like you say, a blue sky day, but we're planning for the worst case scenario. So yeah, we've planned for a worst case scenario, hoping for the nice day that everything goes smoothly and whatnot. So yeah,
Brian has helped us tremendously. Sean has helped us tremendously with the not a blue sky day, the blizzard in February. Here's 17,500 shots, Abington. Good luck. All of that. So we will be ready. We just won't know what we're going to be ready for till we get closer to the actual event.
And speaking, I can tell you, looking around throughout the 24 communities that I deal with, that Abington is much more prepared for it than a lot of the other communities are. So you can have a lot of faith in that fact.
Thank you, Brian.
That's reasonable.
Thanks to you, Marty.
Yes, absolutely, Marty.
Thanks. It won't be for lack of effort, I can promise you that.
I did have a question. So hypothetically, I understand this is a loaded question, but when do they expect to start rolling out the vaccine? Granted, everything.
Everything points to or the end part of December, January. We honestly won't. We really don't know. I mean, this is as fast as any vaccine that I'm in modern. Well, maybe H1N1. This is fast for even a pandemic vaccine. So I don't really want to speculate.
Yeah.
But let's say Pfizer's 90%, Moderna's 94%. It looks really, really good. FDA says, you know what? This is one of the ways we're going to get through this. Go for it. You might not, and then they have to scale up production. I know that they said they were looking, a couple million doses right off the bat, right? Depending upon infrastructure, I would be surprised if we started seeing like MGH type facilities. I'd be surprised if they got it anywhere before the end of December. Pleasantly surprised, please. I'm begging you, Pfizer and Moderna, pleasantly surprise me, because that's one of the things that's going to get us through this. So let's pretend then that happens in the middle of December, and I hate doing this, but it's important that we at least have some type of visual, some type of plan. I don't think that it becomes commonplace until it's early. Commonplace meaning it is just a thing you can go get if you want it, right? We've done all our first responders, we've done all our healthcare workers, we've got all of the people in high risk community. We might be looking at May for it's now at CVS, right? Or it's for normal average. No, that's for a resident to just go get, right? And that's all wishful thinking.
Yeah. And
that is throwing darts at a calendar, and I'm just hoping that happens that way. I am in no way an immunological expert or an expert in vaccines. This is just, I'm basing that on, 24 years in medicine, 20 of it as a healthcare provider in the military. And that is just me being, a positive guy and wanting the vaccine so bad.
Well, thank you, Marty. Appreciate it. And love the positive energy too. So
yeah, I'm trying, man. In the meantime, wear a mask on, stay away from people and stay home when you're sick.
Absolutely.
All right. Any other questions or discussions for Brian or Marty on vaccines?
Thank you, Brian, for coming. I really appreciate it, man.
No worries.
Yeah, thank
No
you,
worries.
Brian.
Thank you, Brian.
Take care.
Before we move on to the next item, I just wanted to circle back to COVID-19 for a moment, because there was a couple of questions from the community I forgot to bring up. One question from somebody on Facebook: are we actively encouraging people to get tested if they think they might?
Always 100. Yes. Test. And then when you're done testing, test some more people to get tested. Test. If you think you might have COVID, or you think you might have been testing, please get tested. Testing is how we put the fires out. I hate to use that analogy, but if you get tested, then you can stay away from people, and you get off the road. You're out of the traffic. You're out. So I'm a huge advocate for mass, rapid, fast as humanly possible test. So please, yes, you think you're symptomatic and you think it might be COVID, get tested. If you think you might have been in close contact with somebody, get tested. If you just want to get tested, get tested. Test.
Yeah, and especially for people who work, perhaps they travel for work. I mean, I'd be surprised if a lot of people are traveling for work. And if you go outside of Massachusetts, if you come back, well, especially before you leave, get tested. And when you come back, get tested. For work, I've had to travel during this time twice. And both times, before and after I left, I got tested, just to be on the safe side.
And the Massachusetts travel order is still in effect?
Yes. Yeah.
So please, everybody, as much as you can, follow that.
Marty, can I just bring up a point that you sure? Oh.
Uh-oh.
Did we lose him?
Oh, he shut his video off, but he's still here, it looks like.
Yeah, sorry, my daughter interrupted.
Oh, no worries.
All right. Sorry about that. I had a daughter emergency.
Just one point that maybe is not as a vast amount of knowledge that everybody has this information. If you go on the government website and you look up "Stop the Spread" testing, There's free testing. I don't know whether everybody's aware of that, but it's free testing. I know that's like if you go to CVS, they take your insurance card or whatever, and there's other places that you can, urgent cares, they take your insurance, but they're doing free testing at the Stop the Spread locations. And there's a
Massasoit is
list.
the closest one to us, and Randolph is those websites. Thanks, Brian.
Yep.
Great point. Those websites are on our website under news and announcements. And I wish more people would take advantage of that. The Massasoit one, especially, the results are coming back in like 8 hours.
I can tell you, I was tested there, and it came back in I want to say it was 22 hours. It was back.
I
So
mean, that's
pretty good.
really, really good.
Yeah.
Especially for the volume that they're doing. They're doing thousands of testing.
Thousands.
Test positivity rate is in the 17s per 100,000 right now. So let's try to get that down to the single digits.
Guys. The other question that was brought up, and again, I think we've had this conversation, but just for the sake of our for the public, several communities around us are doing their own dashboards. I know like Brockton is doing one, so it's been asked if that's something that we can do in addition to posting our daily numbers, and if there was a reason why we weren't. So just throwing that out there.
A dashboard that lists what specifically?
Let's see. I think they're looking at percentages and recovered cases.
Well, we list recovered cases under the cases not being tracked anymore. So I mean, that's just cases that are not being tracked include patients who are no longer with us, people just lost a track because they didn't answer our phone calls or they moved away, and all of our recovereds. All of the rest of the stuff can be, the state is already compiling, and it felt like just extra work that since the state is already doing, they're doing our positivity rate, they're doing our percent positivity rate, they're doing our numbers over the course of 2 weeks. And the school set up their dashboard to say how many contacts and positives are in each of the schools. If there was a specific need, like if someone really wanted to know who in Abington is in like an ICU or who is admitted, that is getting close into the I'm giving you too much information, because again, there's only 41 active cases, and I just wouldn't want to risk putting someone's HIPAA data or telling someone, hey, of 40 cases are active, but one is in the ICU, and then there's a certain amount of buzz, there's a certain amount of you wouldn't have to do much detective work, I think, to figure out who that one person in the ICU is. And it's just, I have people's best interests in heart by not doing things like that, especially since the state already kind of does a lot of that data-driven analysis, which I review every day to find out our epidemiological stats. So that's really why. It's not because we're trying to like hide something or anything like that. We've had the vast majority of Abington's cases have recovered and moved on. With some exceptions, obviously, because that's everywhere. I mean, there's been over 10,000 deaths, or excuse me, I think it was 1,300 deaths, and I just looked this up today. I can't believe almost 1,300 deaths in Plymouth County alone. I mean, we're a big county, but that's way too high a number in any.
Wow.
So, in all of that's compiled by the state, and I recommend everybody taking a look at all that data if they really wanted to know. But it's just mostly to protect, patients' anonymity, and that it's certainly not for not wanting to have full disclosure and transparency. If you call me, I'll happily have a conversation with you and tell you all about everything that's going on. But I wouldn't want to even accidentally give away somebody's private information.
And that's the one thing I was going to follow that up with is at any time, if anybody has questions or concerns, please call the health department. Marty and Lindsay are more than happy to talk to you when they're available. And at the risk of upsetting people, I will reiterate that no information on a dashboard should change your daily behavior. We should be practicing universal precautions. So it really doesn't matter if 400 people in Abington are sick. We should all be wearing masks and washing our hands and social distancing.
True story.
That's my soapbox. Next item on our agenda, flu update. So are the flu clinics wrapped up, or are we still?
This week we are doing it for the school staff. We have set aside availability for our faculty and staff of the schools to come in at specific hours, and we are still doing flu shots in the clinic. Sorry, went back to being a healthcare provider there for a minute. We are still doing flu shots in town hall. If you want them, call us. We'll set it up. Come in, knock on the door. If Lindsay's there, well, I'm sure she would love to take a break from phone calls and do some actual patient care. We still have shots to give. We would love to give them. Please take advantage of that. I anticipate another round of Council on Aging flu shots next week after I talk to Suzanne again before our Thanksgiving break. And of course, that will be open to school-age kids and all adults too. But while we have the shots, I would love to get more people in there for that.
Awesome.
Hey Marty, I have a random question. I don't know if this is like something that's ever come up before and it just doesn't work logistically, but somebody in a neighboring town told me that I think it may have been Hanover, they did their flu shot clinic in the same place as voting. So people like literally went through the voting and then walked straight on through and got their vaccination on the way out. I mean, obviously like the time period doesn't work for right now. I just wasn't sure if you were speaking to like the Council on Aging for the future, the next time there's like town election stuff, maybe that's something we can do in the same spot. Because I think the people in Hanover, they said it was a really positive experience. It was like a one-stop shop. They got both done and they got a pretty good part of the town.
Like a lot of you, I love the idea of one-stop shopping. I feel when we will look into that next November election style season.
Yeah, we got like, yeah, I know it's a little late now, but I just figured proactively bring it up.
Well, the primaries are also in September. So that's when flu season starts. I mean, it's not out of the realm of possibility. And I love me some one-stop shopping. I was the guy and yeah. Let's do that.
Something positive to look forward to.
Yeah, right. Oh, there is a future. It's going to be great, guys.
Any questions or discussions on flu vaccines?
Come get them.
Come get them. Call the health department.
Mhm.
All right. The next item on our agenda, Mr. Haggerty has a mental health awareness report for us.
Thank you,
Alex,
Mr. Chairman. Thank you, everybody. So I did print out, I did send it to Marty, so hopefully I can, I put it up on my social media. It's a mental health awareness little thing, little factoids, warning signs, symptoms, where to go for help, and best ways for prevention. It's a 3-page thing. I'm not going to read all of it, but this is something that's very personal to me. And I know it's definitely very personal for a lot of residents, parents, students, and everything. And I think in normal situations, mental health is something we need to all look at and take care of. But being in COVID-19 in this pandemic, being under quarantine, it's really made things a lot harder. People struggling, with mental health, whether it's depression, anxiety, bipolar, or, PTSD, OCD, all those things. And I just wanted to bring this up, just to show, for those people out there in Abington, and not just in Abington, but all across, just to get a message out to people that it's like, there are ways to help. We're not alone in this. And I was just going to read a couple of things, like just some things to look out for, like warning signs, like certain symptoms, feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worries, or extreme feelings of guilt, extreme mood changes of highs and lows, withdrawal from friends and family. Definitely, during COVID-19, we've been seeing that, being socially distanced from everyone and quarantining. Detachment from reality, inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, problems with alcohol and drug use. That's a big one. I know, and the governor has talked about this a couple of times, that the addiction cases are on the rise, overdoses are on the rise, everyone being in quarantine, it's tough. But, I think, so if you're struggling with those things, or if you're a loved one and you're seeing someone struggling, reach out to help. So in certain situations, so like if someone or your friend or a coworker, someone you loved is struggling, don't be afraid to reach out to the person, and simple asking of, how are you doing? Or, or it's like, how's your day going, or things like that. And really go with it with patience and an open mind, and if the person opens up to you, that's great. And that's wonderful. But if they open up to you, be a good listener. And then go from there. Don't force anything on them and says, oh, you need to do this, you need to do that. You go with an open mind and kindness. Now, if the individual knows or sees they're seeing symptoms of mental health issues or problems, from personal experience, I know this is easier said than done, but speaking up does so much. Even if it's, I'm having a bad day, saying to someone that you know and you trust, I'm having a bad day. And really just to start a conversation, to have something to say, look, I need help. And from personal experience, I know that this is very life-saving. So those are those are the symptoms, and also what things you can do as watching somebody go through this or being the individual. And to cut it short, there's also some helplines that I have up here. One that's a big one, the Emergency Services Program Mobile Crisis Hotline, 1-877-382-1609. There's many hotlines like this that it's 24/7, 365 days a year, where you can call into a professional and have your voice heard and express how you're feeling and get through these things. And it's been so helpful. There's also one for adolescents and teenagers. It's a website called okaytotalk.org. It's for kids to share their experiences and reach out to other people and read inspirational quotes, watch inspirational videos, and just really trying to help. There's so many outlets out there. I mean, even if you go to the Massachusetts State website, there's a list of facilities. You just put in your address and a list of facilities that are nearby that can help you with mental health. To cut this short, and then there is best ways for prevention. Pay attention to the warning signs. Start to recognize, especially friends and family watching somebody. Watch out for the warning signs, especially during COVID-19 right now. I mean, granted, in general, but now it's even tougher. Get routine medical care. Talk to your doctor, and talk to your professionals. Get help when you need it. I mean, it's definitely easier said than done, but it's out there. And, take good care of yourself, be in good health, and try to be in good spirits. I wanted to finish with this, because this is such a personal thing for me. And a lot of parents have reached out to me in Abington, just to send a message to our young people out there who really, I mean, granted, this has been a odd and horrible year, but, for especially our young people, who seeing things completely change. I mean, we all have, but I wanted to specifically say this, and speak from the heart. I wrote it down so I don't mess it up. As a survivor of severe depression in the past, I understand the struggling hardships individuals face during emotionally hard times. When I was a freshman in high school, I struggled feeling like an outsider. I felt lost because I couldn't admit to myself who I truly was, and I feared what the world would think of me. I believed the world had punished me when I was born gay and having Asperger's syndrome. I kept all those dark feelings to myself. The weight of keeping to myself those horrible feelings took a toll on me, and I attempted to give up on life. When the times took a turn for the worst, I took a chance and spoke to a person I trusted. And because I spoke up, I'm alive today. When I spoke up, I was then pointed in the right direction to get control of my life once again. Each of us on this earth has opportunities and the willpower to shape our destinies. Right now, our world is living in unprecedented times. Social lives are dismal. Kids miss being kids. Businesses are hurting. People are dying from disease. And the headlines in the news are always negative. This has led to an increase in depression, attempted suicide, and cases of mental health issues. We must look out for one another. There is light at the end of the tunnel. When we stay positive and care for one another, we can overcome any challenge. We are strong. I want everyone to know out there who is struggling with mental health and or you know someone and someone you know and love is struggling to know you are not alone. Problems are temporary, wounds heal, days get brighter, we grow, we learn, and life is a gift. That is why it is called the present. You have the power to make your silver lining shine. So shine on. Thank you.
Thank you, Alex. Any questions or discussion for Alex?
I'll just say thank you very much, Alex, for sharing. I think there's a lot of stigma around people speaking candidly about mental health, and without people who are willing to speak up, the stigma doesn't go away. So thank you very, very much for doing your part today to take away some of the stigma about being able to speak candidly. And hopefully your example will give the courage to other people to do the same.
Thank you, Christina.
Yeah, thank you. Thank you for sharing that with us, Alex.
Thank
Much
you.
appreciated. All right. The last item on our agenda, I'm going to apologize for because this is partly my fault. Way back when this pandemic first started and we switched to virtual, we had decided to put off approving our minutes until we were meeting in person. And we now have like 20 meetings worth of minutes to approve. So,
To be
And-
fair, we thought that was going to be like in 3 weeks after.
yeah, and just turned into this non-ending thing. So, has my first question is: has everybody had a chance to read the minutes?
Yes.
Yeah.
My second thing, and I don't want to take up more time than we need to, but unfortunately, because there was an election in there, we can't just blanket approve all the minutes. Because Christina didn't join us until July 6th. So she would need to abstain for any minutes prior to that.
I abstain.
And honestly, I didn't pull through to see if any of us were missing from individual ones. So
I know
I
I
have
was
all of them
missing
open.
from one or two.
I have all of them open, so as we go through them, if there's people missing, I can say that.
okay, cool.
Oh, you're awesome, Aaron.
Oh, thank you. My CPU is running crazy.
All right. So let's just knock this off the best we can, starting with minutes from November 16th. Do I have a motion to accept?
That's today.
Oh, that's
November. This is. Oh, I'm sorry. That's today's agenda. Sorry. From January 27th. Do I have a motion to accept the minutes from January 27th?
I'll make a motion.
Excellent. Do I have a second?
I'll second.
All in favor, say aye.
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 Any opposed? All right, January 27th approved. March 2nd, do I have a motion to approve those?
I'll make a
I'll make
motion
a
to approve.
motion.
Do I have a second?
I'll second.
All right, all in favor? Aye.
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 Any
Aye.
opposed? No, those are approved. April 6th, do I have a motion to approve those?
Linda was not present.
I'll make a motion.
Aaron, do you second?
I second.
All in favor?
Aye.
All right, April 6th are passed. April 21st, do I have a motion to approve those?
I'll make a motion.
Awesome. Do I have a second?
I'll second.
All in favor, say aye.
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 All opposed, say nay. All right, passed. May 4th. May the 4th be with you. Do I have a motion to accept those minutes?
I'll make a motion to accept those minutes.
Do I have a second?
I'll second that motion.
All in favor?
Aye.
Aye.
Opposed? No. All right, May 4th. May 18th.
Linda was not present.
Okay. Do I have a motion to accept those?
I'll make a motion.
Aaron, do you
I'll
second?
accept. Nope. I'll second.
All in favor?
Aye.
Opposed? No. Passed. June 1st.
I'll
So
make
you
a
guys know
motion.
the drill by now.
Yep.
Yeah.
Okay. I'll make a motion.
All right, do I have a second?
I'll second.
All right, all in favor, say aye.
Aye.
All opposed?
Aye.
say nay. Okay, approved. June 15th.
Linda was not present.
I'll make a motion.
And I'll second.
All in favor?
Aye.
All right, now Christina gets to join us.
Woohoo!
July 6th. Do I have a motion?
I'll make a motion to accept July 6 minutes.
Do I have a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? No, approved. August 3rd.
I'll make a motion.
Who'll second?
I'll second.
All
Linda
in
can
favor?
Aye.
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 Opposed? Passed. September 8th.
I'll make a motion.
Do I have a second?
I'll second.
Second.
All in favor?
Aye.
Opposed? Passed. September 21st.
Linda was not present.
I'll make a motion.
Do I have a second?
I'll second.
All in favor?
Aye.
Opposed? All right, that passes. October 5th.
Alex was not present.
I'll make a motion.
Do I have a second?
I'll second.
All in favor?
Aye.
Aye.
And finally, November 2nd.
I'll make a motion.
Do I have a second?
I'll second.
All in favor?
Aye.
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 Any opposed? All right, all minutes passed as written. Thank
Good
you,
job,
everyone.
Chris.
Marty, I can pop by the office and sign those tomorrow if you guys are around. Two quick things I want to say that first of all, thank you to Mary for writing all those and for her lengthy writing on those. There's a lot of information. And the other thing I just want to note from a historical perspective, this has been an insane period of time. And if you look through the minutes, you can see the progression of this pandemic from something that was similar to a cold and nobody in town was infected to where we are today. Those are now part of the town's records. And 100 years from now, when people are studying how the pandemic was handled by towns and cities in Massachusetts, that's our record. So thank you, everybody, for your part in that. We made history. Any questions or any questions or comments? Just trying to bring some positive to that painful part of our meeting. Any questions or comments on our minutes? And we'll try to keep up with those in the future. If not, I will entertain a motion to adjourn.
I'll make a motion.
Do I have a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? No? All right, meeting adjourned.
See everybody tomorrow night. They can make it.
Thank you,
Thank you.
Marty. See you
Thank you.
tomorrow.
I'll be there. Thanks, Marty.
Thank you.